Dr. Mammen Chandy joins us now. He's former director, Tata Medical Centre, and speaking with us on this occasion. Dr. Chandy, thank you so much for giving us your time on NDTV network. Just, I think we should just start with your best experience and something that you truly fondly remember of an interaction with Mr. Tata. Let's start there.
As you know, the Tata Memorial Hospital in Mumbai was started in 1941 in memory of Lady Mirabai Tata. And that is today one of the best cancer hospitals in India. And Mr. Tata was always on the board of Tata Memorial Hospital, Mumbai. And at his visits, he would comment about the large number of people from Eastern India who were in the hospital. He says, don't they have facilities in Eastern India? And that was when, in 2005, he conceived of the Tata Medical Centre, Kolkata, which would provide state-of-the-art cancer care for people in the eastern region of India. And that was when Dr. Dinshaw was appointed as project director. And she kept asking me, come. And I sort of put it off. I was then the head of the Department of Hematology at Christian Medical College, Vellore. In 2009, I retired, and Mr. Krishna Kumar persuaded me to join the Tata Memorial Tata Medical Centre in Kolkata. And therefore, I had my first contact on a rainy day at the site where construction was going on, and I was asked to make a presentation to Mr. Tata on my vision for Tata Medical Centre. Tata didn't say a word, but I was told the next day by Krishna Kumar that he had decided to appoint me as the director. And my first association with Mr. Tata was really at a town hall in the hospital campus. And I remember asking him, sir, why did you buy Tata Jaguar Land Rover? So he looked at me and he said, you know why we bought Jaguar Land Rover? We bought it to have access to technology. I want the same gearbox that is in the Land Rover to be in the trucks we manufacture.
Wow.
Quality was always an essence. I remember once telling him, I want more beds in the hospital. And he looked at me and he said, I will not have patients cheek to jowl in the hospital. So I would remember going and asking for 10 crores for the laboratories, and that would be sanctioned. The buildings at Tata Medical Centre in Kolkata, you would think you're in a research center in Scandinavia. As you know, Mr. Tata is a graduate of architecture from Cornell, and that excellence in terms of the building, the infrastructure that was created at Tata Medical Centre, I can tell you that today, the Tata Medical Centre, Kolkata, is probably the best cancer hospital in Eastern India. And that is the legacy of the Tatas of wanting to give back to society what they earned from society. And I don't think there's any company in the world where 60% of the stock is owned by the trust and is given back to society. So my appreciation of the man was the legacy that he took forward of Jamshedji and JRD, and the fact that we created an institution with the largesse of the Tata Trust, which is, I think today, state-of-the-art, providing much-needed cancer care. Patients don't really have to go anywhere else now. They can get their treatment in Eastern India. So that is my association with this person who was a legend.
What was the initial vision when it came to cancer care, and how did that vision evolve down the years when it came to Mr. Tata going in?
See, at many board meetings, I would bring up the issue that what I want is not just a hospital, but a teaching and training institution. We must teach people how to treat cancer, and we must research the issues that are important to India. And whenever anybody else said, no, we don't really need research, Mr. Tata would say, no, I disagree. research must be an essential component of Tata Medical Centre, and that is our mandate to find solutions for problems which are relevant to this country in cancer. And we've done that with childhood acute lymphatic leukemia. So his vision of saying this is not just a hospital, this is a medical institution where we will train people to treat cancer, and we will also research issues that are relevant in cancer for India. So whatever is state of the art anywhere in the world. I remember when we wanted phase two, within 2 years of opening, we were already crowded out. And I asked the board saying, can we build phase two? And we got the same American architect scanning design. And Mr. Krishnamurthy told me, he said, you will go 5 times to Mr. Tata before he agrees on the construction and the building. But the architect was so good that one presentation, the architect, Mr. Tata, was bowled over and said, go ahead.
What
So
was
we have now a beautiful building in Calcutta.
Yeah, that's just such a wonderful insight there into the man that was Ratan Tata. Dr. Chandy, just want to understand what was a tough thing to persuade Mr. Tata for? Any such experience that you faced where you really had to persuade him to make a decision, or was it always easy if he knew it was for the greater good?
The issue was the expansion. And we wanted a 260 crore expansion just 2 years after the phase one was completed. And I remember talking to Mr. Tata, and his greatness was that he said, I don't think this is necessary now, but if Chandy wants it, Chandy can have it. So that is the insight to say, okay, this guy thinks it's necessary, I will let him do it.